Hey folks, I'm Dr. Ohlson with Sports Medicine Orthopedic Centers. I'm an orthopedic surgeon and I'd like to continue my discussion about shockwave therapy. So this has become a mainstay in our practice, primarily because we have a lot of happy patients that have derived significant relief, sustainable relief with the use of shockwave. So one of the next things I'd like to cover is regarding the different types of shockwave. So it's important to note that not all types of shockwave are the same. Shockwave is primarily divided up into two different categories. The first is known as radial pulse shockwave, or EPAT. So this is a radial pulse shockwave device, otherwise known as the jackhammer. So it essentially consists of a projectile and an air compressor, and it transmits energy directly through the skin into the adjacent tissues to hopefully stimulate a tissue response. So how does it differ from other types of shockwave? Well, it's not really a true shockwave. Not to say that it doesn't work. And there are some conditions that it does work for. In particular, it works primarily for conditions that are more superficial or closer to the surface. That would include like plantar fasciitis and Achilles tendonitis. It can be useful. And also, it's more appropriately used in places where a wide surface area needs to be treated. So I've seen both types of shockwave, a radial pulse and the other type of shockwave known as focus shockwave, is used interchangeably. And it's important to note that there are some very key differences between the two. As I stated before, radial pulse shockwave, otherwise known as EPAT, is not a true shockwave. It uses a projectile and an air compressor. The other type of shockwave that we use in our practice is known as focus shockwave. This indeed is a true shockwave, otherwise known as an electromagnetic shockwave. And this was derived from the initial shockwave technology employed for treating kidney stones, otherwise known as lithotripsy. So this is a focus shockwave device. This is the one that we employ in our practice. It's an electromagnetic shockwave, and this is a true shockwave. There are several different variations on the theme. There's a piezoelectric device and also electrohydraulic device. This is the one we use in our practice, electromagnetic shockwave, derived from lithotripsy back in the 80s to break up kidney stones, and then later became available in orthopedics in the 1990s. So when evaluating different types of technology for our practice, we ultimately decided that focus shockwave therapy was the best for our patients. And the reason for that is we find that focus shockwave therapy can be used to treat the majority of conditions that radial pulse shockwave therapy is used for, and then some. In addition to the conditions radial pulse is used for, we can also use focus shockwave therapy to treat conditions that are deeper in the body. This includes the rotator cuff in the shoulder, includes the hamstring, and it also includes the treatment of bone problems. In particular, we use shockwave therapy for the treatment of fractures that are having difficulty healing. And also overuse injuries or stress fractures, we can also use shockwave therapy. Unlike radial pulse shockwave, focus shockwave has the ability to penetrate through bone. And I think that is a key point. It's a safe technology, but in addition to being used for superficial conditions, we can also use to treat tissues that are deeper in the body that radial pulse shockwave simply does not have the ability to reach. So my goal is not to disparage one over the other. My goal is to give you some understanding as a patient that they're not the same. And there are instances where both may be appropriate, and some instances where one is preferable over the other. Again, I'll say that for superficial problems like Achilles tendonitis or plantar fasciitis, they're both very appropriate. However, when we still get into some deeper types of pathology like rotator cuff issues or issues involving the hamstring or joints or bones, those problems are best handled with focus, which has the ability to penetrate. So that about does it. I very much appreciate everyone sticking around to learn a little bit more about shockwave and the different types that are available. If you'd like to do a deeper dive into the subject, feel free to head over to our website at smocsc.com. I'm Dr. Ohlson, and everyone have a great day.